Okay, this lecture is designed to help you understand central nervous stimulants. Remember that stimulants increase the activity of the CNS neurons. Typically, they are used for treatment of ADHD and narcolepsy, and they do not elevate the mood. That is the difference between them and an antidepressant. They do not elevate the mood. And the principal focus of this lecture will be amphetamines, methylphenidate, and methylxanthines. Amphetamines. Let's focus on the amphetamine category. Amphetamines are a powerful stimulant, but they also have an effect on the peripheral system. They usually cause cardiac stimulation and vasoconstriction. So, what's their mechanism of action? Let's look at amphetamine. The mechanism of action is that it causes the release of norepinephrine and dopamine, as well as it slowly allows for slow reuptake of the transmitters. The pharmacological effects mostly result from the release of norepinephrine. For the CNS, you have increased wakefulness, decreased fatigue, increased motor activity. They stimulate respiration and suppress appetite. Okay. Your cardiac effects, you have an increased heart rate, increased force of contraction, leading to vasoconstriction. They're therapeutically used for either narcolepsy, because it keeps you up, or ADHD. Now, there's a question as to whether we should use an amphetamine for ADHD, but it can be used for that. The main side effect is weight loss, and that's why back in the 70s and the 1970s, you had lots of people taking amphetamine in order to lose weight and thus becoming addicted to it. Remember that they have a high potential for abuse and dependence, and we as the nurses need to be careful of withdrawal. We need to make sure if a patient's on it that they don't just stop taking it, that they have to slowly come off and slowly be weaned off so they don't go through that withdrawal. Because if you remember, with any drug that you take, if you withdraw and if you have a sudden stoppage of it, what's going to happen is when you go through that withdrawal, you do the opposite of whatever that drug effect had. So, this is supposed to keep you up, supposed to keep you going, increases your heart rate, increases your blood pressure, increases everything. So what's going to happen when you withdraw is all that's going to slow down, and you know what happens when we have a slowed down heart rate. If it slows down enough and stops, we get another problem. All right, so let's look at methylphenidate, also known as Ritalin. It has the same mechanism of action as the amphetamine. Its uses are the same. Everything is pretty much the same as the amphetamine. It's just what's better is it doesn't have that high abuse potential. But again, it is a speeding thing, and it is used to speed up the brain. One of the multiple problems that my son has is ADHD with impulsivity. And when we took him to the doctor, one of the first things he said to us when he was teaching us about it and what was going on, he said, he has one side of his brain that's very fast, and he has one side of his brain that's very slow. He said, in the fast side, he said, if you think about it this way, the fast side will say to him, run out in front of that car. And the slow side is the side that's supposed to tell us, no, that's not a good idea. Maybe you should wait. He said, but what happens to him is his fast side says, run out in front of the car. And he has run out in front of the car, been hit, and been in the hospital for a week before the other side catches up and says, that's not a good idea. So we give Ritalin, we give all these kinds of things to get that slow side to catch up. We don't slow down the fast side. We get the slow side to catch back up. Dextromethylphenidate, which is another form, which is Focalin. Focalin's a big one. That's what my son's on. Again, same thing as the amphetamine. Same mechanism of action. Same effects. Same uses. Just don't have the abuse potential, and it's a little bit better than the amphetamines for people to use. Okay, let's look at the methylxanthines for now. Caffeine is probably the most representative drug of that, and yes, caffeine is a drug. I hate to tell all you people who think caffeine in coffee is not a drug and not addictive. It is. That's why you need it every morning. Mechanism of action, we're not completely sure how it works, but there's several ideas that have been proposed about it. We think it might reverse the blockade of adenosine. We think it enhances the calcium going through the cycle, and thus you have an inhibition of the nucleotide. But basically, no one's really sure how it works. We just know that it works, and we know that it's a drug, and we know that it's addictive. It decreases drowsiness. It increases the capacity for prolonged intellectual exertion, which is why we all love coffee, because it does actually make us think better, actually make us perform better. Okay? But we do build up a tolerance to it. We do those other things. It also acts as a diuretic. Okay? Think about it in the morning. It's that good old cup of coffee and makes you have to go to the bathroom one of two ways. Therapeutic uses, it's mainly used in drug form. If you're giving caffeine itself as a drug, not in coffee, not in other things, but it's mainly used for narcolepsy to promote wakefulness. It can be given IV. We can give it to relieve migraine headaches. Okay. And it can be given with other opioids or with opioids to enhance the ability of the opioids and the effectiveness of the opioids. Why we like caffeine is there's not many adverse effects except for toxicity. So you could take too much caffeine. I thought it was funny as I was going through this and making out this lecture really quick. There's that story now in the news about a driver in, I think, California that was driving erratically and got pulled over. And when he got pulled over, they did a breathalyzer, they did all this, everything came back negative and said he wasn't drunk, but the arresting officer said, well, but he was showing signs of being drunk and not being coordinated and not being all this, and so they took him to the hospital. Well, all of his blood tests came back normal. He didn't have any alcohol in him. All he had was caffeine. And so they don't think it's going to go anywhere. They don't think, you can now be arrested for driving while on caffeine. But it was just interesting that has come about. So let's move on to look at attention deficit and hyperactivity disorder, ADD or ADHD. Okay, it's the most common disorder of childhood. It's usually an attention and impulsivity. Again, I told you about my son. We had him. They don't like to diagnose it early, but at 3, we knew some things were going on. So our physician sent us to the child psychologist who sat down with us for an hour talking about how they don't like to diagnose this early. It's really hard in young kids to tell if they have ADHD. Sometimes he's just being a boy and he's 3, but he would badly look at him for us. So he sent us out into the weight room and he said, I'm just going to play with him for a while. Might be 15, 20 minutes. I'll come back out and get you. 5 minutes later, he walked out and he said, oh yeah, your child has hyperactivity or attention deficit hyperactivity disorder with impulsivity. He said, there is no doubt in my mind from what the teachers have said, from what you have said, and what I have observed. So he started fairly young on medication, and you can tell the difference from medication to not medication. We've done a good job of the medication does not knock him out. He is not a zombie. He is much calmer, much quieter. But know that the management of ADHD focuses on allowing the child to slow down and concentrate, but to not be knocked out. And that's one of the things is it does allow him when he's on it, which we don't get very often as parents, because he's on it during the school day. So it helps the teachers, not mom and dad. So, in my story, as I told you about the sides and catching up and one being slower, one being faster, as the doctor said, we have to get one side of the brain to catch up with the other side. And the way that we do this is through the use of CNS stimulants. Okay? And we've already talked about the typical stimulants already, the amphetamines, the methylphenidate, the dextromethylphenidate. The major adverse effect that you have to worry about when they're on it for ADHD is insomnia and growth suppression. And if my son does take his medicine too late, then he doesn't get to sleep at night. It does keep him awake for that. So he takes it in the morning, and in the morning only when he wakes up. So it gets him through school, and by the time he comes home at 3 o'clock, it is worn off and he's going crazy, but I know he will go to sleep that night. The other side effect is that it does suppress his appetite, which is what suppresses the growth, because he does not want to eat when he's on it. So he'll usually I can get a good breakfast in him, but then I give him his medicine. He may eat some lunch, he may not, and we've told the teachers don't worry about it, because when he comes home and he's not on the medicine, then he eats me out of house and home and he catches up. But we do go every 6 months to have them check and make sure that he's growing the way he should be growing. There's not many non-stimulants, so we're not really going to look at that. Let's look at the major nursing implications. Okay. It's a quick look at these. The idea is you want to minimize the adverse effects. So if an adverse effect is that you got a fast heart rate, you're moving fast, you have some weight loss, as nurses, we want to minimize that. So we're going to talk to the patients about how do you not do that. Amphetamines are typically given orally, but they can be given through a patch. I do have a friend whose child has ADHD, and she puts a patch on her, and it's amazing. While the patch is on, Sammy is nice and calm and cool and collected. As soon as that patch comes off, Sammy is a different person. Your advice to patients is to use the smallest dose possible of any of these drugs, and that they should never stop using these medications abruptly. They need to wean off from them.